Hi, this is Kenny, the co-founder of Aiskyra. Here's a quick tutorial on how you can generate a full patient care plan using our AI drug information assistant, which leverages our custom drug information database that includes best practice guidelines in Canada, as well as over 1 million scientific articles. Let's start by putting in some information about our theoretical patient. The background is that they're 59 years old, they have hypertension for many years, dyslipidemia, and obesity. They had a heart attack 2 years ago. They're currently taking perindopril, bisoprolol, aspirin, atorvastatin, ezetimibe. They've come into the pharmacy because they saw an ad for Ozempic. They are wondering about their heart health and their weight. They're already doing improvements with their diet and exercise. And they're asking you, what is the evidence of Ozempic for themselves? And if not Ozempic, what else could they be doing? Okay, if we start at the top, there's a summary of the question, and then followed by evidence for semaglutide from a variety of different trials, as well as a trial called SELECT, showing that in patients who were overweight or obese without diabetes, but had established cardiovascular disease, a weekly semaglutide at a dose of 2.4 milligrams reduced endpoint of cardiovascular death, MI, and non-fatal stroke by about 20%. It also showed sustained weight loss over a follow-up period. If we want to look more into this, you can see that says reference number 2. Scroll to the bottom and check out reference number 2. And it opens up the New England Journal of Medicine article called Semaglutide and Cardiovascular Outcomes in Obesity Without Diabetes. Now, if we just go straight to the conclusion, it says that there is evidence supporting the benefit of using semaglutide to help with cardiovascular risk reduction as well as weight loss, even if the patient does not have diabetes. So now let's create the care plan. So now I'm going to say generate a care plan for semaglutide for my patient. So specifically with the care plan, the AI will generate goals of therapy, therapeutic alternatives, safety endpoints, monitoring follow-up, as well as the recommended medication. Care plans are especially useful for clinicians who are involved in chronic disease management, such as hypertension and diabetes, COPD. So if we just scroll back to the top, it says care plan for weight management with semaglutide, listing out the drug therapy problems, goals of therapy, therapeutic alternatives, including how it's dosed, its effectiveness, how quickly it works, as well as any safety parameters. It also includes any specific medication considerations, for example, renal function, if that was provided in the context. Specifically, Aiskyra has recommended semaglutide at 0.25 milligrams subcutaneously once weekly for the first 4 weeks, eventually titrating upwards over time to 2.4 milligrams, which was the one studied in the trial. If starting a medication also necessitates deprescribing another medication, that would also be mentioned in the deprescribing conditions. Finally, we go into the monitoring plan. So when is the next follow-up visit for this patient? We'll be discussing with this patient in terms of efficacy and safety at these follow-ups. Finally, it includes the contact information of the clinician, as well as links to references. So this could be saved as a PDF or copied and pasted into a Word document. And that's it. I hope you can see how easy it is to answer drug information questions and then also generate a care plan when there's some context about the patient. If you have any questions, feel free to reach out to us.